Okay, so this is going to be the video on the heart, and I might jump around a little bit compared to your orange book, but I'll try to hit all of the terms. So starting looking first externally, you can just look at this as the whole heart here, and it's lying inside the pericardial cavity, which is inside the mediastinum. Now, right in this area of the heart, you see we have some major vessels entering and exiting, and so this is called the base of the heart. I know when we think of base, we want to put it down here, but the base in this case means like headquarters. This is where all the activity is. So the base of the heart is here, and the apex of the heart is this pointy side that kind of points down in the lower left side of the heart. Okay, the coverings. It's surrounded by a pericardial cavity that has a parietal pericardium and then pericardial fluid, and then this first layer on this heart model, which is the visceral pericardium or epicardium. Beneath the epicardium is the muscular layer. You can see you can go down a little bit deeper. This is known as the myocardium. I'm going to go over to this one that's already opened up. And then lining each of the chambers in the heart would be your endocardium. So if I were to like focus in here, I would say this is be like my epicardium, my myocardium, and my endocardium. All right, so those are the layers of the wall of the heart. Now, the heart is divided into 4 chambers. They're easy to see here as we have this open. The 2 upper chambers are atria. Each one is an atrium. And the 2 lower chambers are ventricles. So this would be the right atrium, right ventricle, left atrium, left ventricle. Now, on the outside of the heart, over the atria, there are these flaps called the auricles. So they're for expansion, but they're a good way to mark where the atria are when you're looking at an external view of the heart. You also notice that there's 2 like indentations on the heart, one that runs right under the auricles, that's called the coronary sulcus, and one that kind of runs up and down this way, that's called the anterior interventricular sulcus. And that also gives us a pretty good idea from the outside where our 2 atria and our 2 ventricles are. Okay, so let's talk about the function. So the heart is going to receive blood into the right atrium from the systemic circuit, which means pretty much all of the body except the lungs. And it's going to come in through this large blue vessel here. This is your superior vena cava, and the inferior vena cava, which would be down here. On this model, it's where this model is sitting on the base, this little bit of blue here, inferior vena cava. So we're collecting all the deoxygenated blood, and we're coming in through a vein, because veins go towards the heart, and we're dumping that deoxygenated blood into the right atrium, right here. Then the right atrium is going to fill, and the blood is going to go through this structure. This is one of our atrioventricular valves. Now, it's on the right side. This one happens to be called the tricuspid valve. Tricuspid valve. It's got 3 cusps that are going to be opening. Now, how do these valves open? Well, the valves are connected to these strings. These are called chordae tendineae. These strings are attached to these muscles, which are called papillary muscles. We're attached to these muscular ridges in the bottom of the ventricles that are called trabeculae carneae. I know that was a lot of terms all at once. So, tricuspid valve, chordae tendineae, papillary muscle, and trabeculae carneae. There's also muscle ridges inside the atria. Kind of see them represented here. Those are called pectinate muscles. So papillary muscles are down here. Pectinate muscles are up here. So this deoxygenated blood comes from the right atrium through the tricuspid valve and fills the right ventricle. Now the right ventricle is going to receive electrical stimulation, and it's going to be told to contract, and it's going to send the blood up into this vessel. It's hard to see on here. Let me go back to the closed one. So this is obviously my right ventricle. And here is the path we're going to take. Now, this is called the pulmonary trunk, and it's going to give rise to the left and right pulmonary arteries. Arteries take blood away. So if I were to look at it here, we kind of have a cutaway. Right before I enter that, go to this half, this is what it looks like right at the entrance to the pulmonary trunk. So this is called the pulmonary semilunar valve. So the blood has gone from the right side of the heart to the pulmonary trunk and will be carried off to the lungs. Then it is going to come back to the heart. Remember, the vessels that bring blood back are veins. So if I look at the back of the heart here, I see these 2 red and these 2 red. That's the aorta. These 2 red. That's what I get for looking through the camera. These are going to be my pulmonary veins, and they are going to be bringing oxygenated blood to the left side of the heart, into the left atrium. Okay, so looking at this, okay, we would see them emptying into this left atrium. This is now oxygenated blood that is ready to go out through the body. So the blood will go from the left atrium through this valve, which is called the bicuspid or mitral valve, into the left ventricle. We still have our chordae tendineae, we still have our papillary muscles, we still have our trabeculae carneae. Now, when this side of the heart, this ventricle contracts, it's going to propel the blood up through this direction. And so this is attached to this vessel here, which is my aorta. This is called my aortic semilunar valve. And then here's my aorta where it's going up. It's the ascending aorta. Where it curves around the top is my aortic arch. And then when it starts to go down is the descending aorta, which will become the thoracic aorta and the abdominal aorta. Okay, so that's kind of the path that the blood is going to take. And so going from the right side to the lungs and back is the pulmonary circuit. And then going to the left side through the ventricle, left ventricle to the body back to the right atrium would be the systemic circuit. Now let's talk a little bit about some other features that we find in here. How are we going to send the electrical current through the heart to all of these areas? So our pacemakers, right here represented in green is my SA node or sinoatrial node. And then this little spot right here is my AV node or atrioventricular node. Sorry, I got tongue-tied there for a minute. I want you to also notice that there's this little depression inside here. This is an adult heart, and so we would call this the fossa ovalis. When this person who owned this heart was developing in their mother's womb, this used to be a hole that would pass through here to here, and it was called the foramen ovale. There was also another shortcut here from the pulmonary trunk over to the aortic arch. When this person was in their mother's womb, this was a tube, and it was called the ductus arteriosus. But once they took their first breath, these two passageways should have closed, and now this one is simply called the ligamentum arteriosus. Okay, so we had our AV or SA node and our AV node, and then the AV node is connected to this part through the septum. The interventricular septum is this wall that divides the two ventricles, and through it is running like an electrical cord. So the upper part here where it's one singular cord would be the AV bundle or bundle of His, and then right here at this part of the septum it splits into two halves. These are called my bundle branches, and they come down, and then each bundle branch turns and lines the floor of the ventricle, and then these would be called my Purkinje fibers. So the electricity starts at the SA node, gets passed to the AV node, goes through the bundle of His, through the bundle branches, and then gets distributed by the Purkinje fibers to all of the muscles inside the ventricles and tells them when to contract. Okay, so we've got the valves, we've got the vessels, we've got the chambers, we've got the muscles. Let's see if there's anything else we are missing. Let's do the circulation of the heart itself, which is going to require that we see it from the external view. So as soon as the blood goes up into this aortic semilunar valve, it's in the aortic sinuses, it's going to immediately branch off into the right and left coronary arteries to feed itself. So this is where it looks like where it's coming off the aorta, and then these are where we're going to find them on the surface. Over here under the right auricle, we're going to see the right coronary artery right there. And then over here we see the left coronary artery coming out from underneath the left auricle. Now the left one's going to split. Half of it's going to curve around the back of the heart, around the top in that coronary sulcus. And so this one's going to be called the circumflex artery. The other half is going to go vertically down the front of the heart, and this is going to be called the anterior interventricular artery. So they're going to deliver oxygen to the various areas of the heart. And then we're going to pick up the deoxygenated blood and we're going to bring it back. We're going to bring it back by this is the great cardiac vein, and it goes around to the back. Let me turn it. And then it gets even wider, even though it was already pretty wide. And then back here on the very back of the heart, it gets its widest. That's called the coronary sinus. And it dumps that deoxygenated blood immediately right back into the right atrium. So that blood can go right back to the lungs and get oxygenated again. So again, we had our right coronary artery, our left coronary artery, which splits into the circumflex and anterior interventricular, and then we're going to collect our blood by the great cardiac vein and by the coronary sinus on the back. Okay, I think we have covered everything on the list, and you should now have a complete understanding of all of the structures of the heart.